Hello, my name is Juan Ramirez. I'm going to be doing a video on fluids administration and on Piggyback. I'm going to go ahead and perform hand hygiene. Wash my hands. Then I'm going to go ahead and don gloves on. Come into the patient's room. Hi, my name is Juan. I'm going to be your nurse. I'm going to go ahead and hang some fluids that the doctor ordered and some medication. What's your name? John Smith. Check your armband. Your date of birth. 2555. Okay. Alright, I'm going to go ahead and close the curtain for privacy. So I'm going to go ahead and show you the supplies I'm going to be using. I'm going to go ahead and identify them. So we're going to go ahead and start with the spike, which I'm going to be inserting into the fluids in the bag. And this is going to be the drip chamber. I'm going to control the rate with this. And then we're going to have the clamp roller, which I could control how much it goes and or stop it. And then we're going to have the white site. This is where I will administer medication on this white site. And then we're going to have the adapter in right here, which I will connect to the IV catheter in. So I'm going to be giving 150 mLs of fluids. So I'm going to go ahead and get it ready. Okay. So I'm going to go ahead and remove this part. And I'm going to spike the bag with this right here. I'm going to go ahead and spike it. Okay. I'm going to close this. And I'm going to go ahead and set and start priming it so I can get all the air out. Which I'm going to hang right here. Okay, so I got the air out. And I'm going to go ahead and connect it to the patient. And if I was connecting it to the IV catheter, I will go ahead and swab it with alcohol and flush it with the normal saline. And then I'll go ahead and connect it. So that's connected to the patient. And now I'm going to be giving the IV via gravity. And to do that, I need to calculate how many drops per minute I'm going to be giving. So I'm going to be giving 38 drops per minute. The way I calculated this, it was my factor drop. It's 15 drops per ml. So I divided that by 60 minutes and I got 0.25. Then I times it by the volume, which I'm going to be giving 150 mLs, and it comes out to 37.5. So I rounded it up. So I got 38 drops per minute. So in order to do that, I'm going to count for a whole full minute, and I want to calculate it to be 38 drops in a minute. Okay. Start now. 1, 2, 3, 4, 5. 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 31, 32, 33, 34, 35, 36, 37, 38. So that's 38 per minute. So I'm going to leave it at that rate. So every minute, the patient's going to get 38 drops per minute. So that's running. Now I'm going to connect the patient. I'm going to give them medication through IV Piggyback. So I'm going to go ahead also go ahead and spike that and get it ready. So before I get it ready, I'm gonna go ahead and check the 6 rights for the patient. So I'm gonna check the name, right patient, John Smith. You see your armband, John Smith. Date of birth, check in is the same. I'm gonna confirm the right time and the right date. So it's given today for today's day and today's time. Okay. I'm gonna confirm the medication. I'm gonna give amoxicillin 250 milligrams in 100 mLs. So I'm gonna give that. So that's the correct. I'm gonna check for the route. It's gonna be IV intravenous, and I'm gonna check for the route, which is IV intravenous, and I'm gonna check. And after that, I'm gonna document. So I will document when I give it that I given it, and I'll click it off and chart it off. So I'm gonna do that, and I'm gonna also check for allergies. Make sure the patient's not allergic to this medication. So I'll go ahead and see amoxicillin, and I'm gonna look at the chart, and there is no allergies for this. So I'm gonna get it ready and also spike it and prime it. Take this off. Okay. I'm gonna get the air out. Okay, so the air is out. And this is a fluid that is running, and I do have it at 30 inches above the IV site. So from the IV, from the patient's arm, it's at 30 inches above the site. So now I'm gonna go ahead and switch these two. So this is the medication I'm going to be giving, amoxicillin, and this is the fluids. The reason I changed it for this one to be higher, because I want this medication to go in first, and if it's higher, the head pressure is going to be stronger, so it's going to make the medication go first. If I do keep them on the same level, they're both going to be at the same pressure, so one or the other will not go faster than the other. So by being higher, it helps it to go administrate first, and then when it's empty, this fluid will take over. So for this one, I'm also gonna do by gravity. So I'm gonna go ahead and count the drops, which I'm gonna be giving it 100 drops per minute. And the way I calculated that was, the drop factor is also 15 drops per amount. So I divided that by 60 minutes, and I got 0.25. And then I'm giving 100 mLs by 15 minutes. So I divided that by 0.25, which I got 100, and then the 400, I got 400, and from the 400, I times it by the 0.25, and it gave me 100 drops per minute. Okay. So I'm gonna go ahead and connect this to the Y piece. I'm gonna go get alcohol swab. I'm gonna clean it. I'm gonna go ahead and let it get dry. So it's dry. Go ahead and connect it. And I'm gonna go ahead and count for a full minute to get 100 drops per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 92, 93, 94, 95, 96, 97, 98, 99, 100. So that's the rate that I want to keep it at. So it's giving me 100 mLs and 100 drops per minute. And this one has 38 drops per minute. So this one is the one that's running right now. The Piggyback is the one that's running. When they're finished, this one will take over. So they're both running now. And that's how you administer IV fluids by gravity. I'm gonna go ahead and remove my gloves. Perform hand hygiene. Is there anything I could get for you right now? Okay, I'll be back in a bit to come and check the IV. Thank you.